Hi, good afternoon, everybody. My name is Laura Wigand, and I would like to discuss with you today some very real public health issues. How many of you have been out at a restaurant or a bar or other public place and gotten a face full of smoke? Have you ever walked down a sidewalk and gotten smacked in the face by this stinky stalker? How about those of you who live in apartments? Have you ever smelled tobacco or marijuana smoke in your own home and you don't smoke and you don't know where it's coming from? Well, this cloud is more than just bad odor. As reported on October 28th in 2020, the Centers for Disease Control and Prevention, the CDC, stated that secondhand smoke kills approximately 41,000 non-smoking adults in the United States alone every year. That's a total of 2.5 million non-smokers that have been killed from secondhand smoke since the Surgeon General first declared the carcinogenic properties of smoking. Why should innocent bystanders be subjected to illness and possible death from others' bad habits, especially in your own home? Well, during these times of the COVID-19 pandemic, it is extremely important to take care of your lung health today. I'm going to explain how second and third hand smoke is hazardous to the health of non-smoking adults and children and animals. And I will also reveal some ways that you can prevent unnecessary exposure to secondhand smoke. According to the Surgeon General's report regarding the health consequences of involuntary exposure to tobacco smoke, which was dated June of 2006, there is no safe level of secondhand smoke. Breathing even just a little bit can be hazardous to your health. Secondhand smoke can cause heart disease, lung cancer, and other acute respiratory illnesses in non-consensual smokers. It can also be a cause of sudden infant death syndrome, SIDS, in children. Today, in the times of COVID-19, smoking, whether willingly or not, leads to more complications and even death for those who contract COVID. A Healthline magazine article on August 20th of 2020 states that medical experts have determined that secondhand smoke, which can travel up to 23 feet, contain tiny water droplets from the lungs of smokers and have potential for spreading the COVID disease very quickly. That's pretty frightening. Well, today, first we'll explain what second and third hand smoke are, where they come from, and why it's alarming, especially in multi-unit housing. Second, I will share some of the health hazards of secondhand smoke on adults, children, and animals, and the implications of COVID and secondhand smoke. Lastly, I'd like to share some solutions that can be done to protect non-consensual smokers and why it's important to level this socioeconomic playing field. So today I learned secondhand smoke from the Merriam-Webster Dictionary on December 11th of 2020, that secondhand smoke is also known as passive smoke. It's not only what is exhaled by the smoker as they smoke, but it is also the smoke that is being emitted from the burning end of the ignited smoking device. Smoking is the leading cause of preventable death in the United States. The latest data from the CDC states that tobacco smoke alone kills more than approximately 480,000 people per year in the United States. Now, how many of you heard of third-hand smoke? I know I hadn't. I knew the concept, but I didn't know what it was. So third-hand smoke is that residue that contains nicotine and other chemicals that is left behind from smoking. It clings to all hard and soft surfaces, so it can stick on the walls, the carpets, the clothing, the drapery, and even pet fur. Children and pets are exceptionally susceptible to third-hand smoke poisoning. They tend to be closer to the ground where it settles. Children will crawl into the ground, pets walk on the ground. The children will put their hands in their mouth, and pets will groom themselves, and they'll ingest this nicotine and the other chemicals, and which carry carcinogens and can lead to mouth, throat, and stomach cancers. The Mayo Clinic reported on August 21st of 2020 that individuals suffering toxicity from touching the particles and the gases that it continues to emit as it sits on these surfaces. After looking through the tobacco industry's smokescreen and uncovering this truth about how smoke can affect the unwilling participant, let's look at why this is a current public health crisis. Secondhand smoke in multi-unit housings. This is a particularly hazardous issue to non-smokers. Secondhand smoke cannot be contained or eliminated entirely with filters. It travels in multi-unit housing buildings through open doors and windows, through cracks in the walls or the floors. It can travel through the shared ventilation systems, and it also travels through the plumbing and the electrical sockets. The only way to prevent exposure is to eliminate it in the first place. COVID and secondhand smoke is an urgent public health issue. During this safer at home order, more people obviously are spending time at home, and this includes not only just people that live in single family houses, but also apartments and condos. And it allows for increased exposure to this secondhand smoke. Even children being homeschooled now, they don't have a smoke-free educational environment necessarily. The California Department of Public Health reported on September 11th of 2020 that smokers have an increased risk to complications and are twice as likely to be hospitalized or even die from COVID than non-smokers. Tobacco-related socioeconomic health disparities are also another concern. According to a study done in Minnesota in 2015 and published by the CDC, residents making less than $20,000 annually annual income are usually apartment dwellers, and 36% were determined to have elevated levels of serum cotinine levels, which are the indicators of exposure to secondhand smoke. This proves the fact that people at lower socioeconomic classes have less access to smoke-free living environments. People also in these lower socioeconomic class usually tend to have less access to health care as well. So this increases the tobacco-related health disparities between classes and races in the American society. So hopefully by now we can all agree that secondhand smoke stinks. So let's see what can be done to prevent this silent killer from taking any more lives. In multi-unit housing, there is some tobacco prevention work being done. California's cigarette tax, the Prop 99 and Prop 54, has funded local grantees like my company where I work to focus our efforts in needed areas of tobacco control in our specific jurisdictions. The state of California does regulate some tobacco policies, such as smoke-free workplaces and restaurants, and it has allowed landlords to make that choice to have their apartment buildings smoke-free if they so choose. However, it's usually more difficult for them to enforce. So county and city governments can further implement more restrictive tobacco policies on a local level. So let's talk about some smoke-free multi-unit housing policies. In a publication published in 2019 by the Public Law Health Center, which is the Tobacco Control Legal Consortium, there is no constitutional right to smoke or toke. It's not a protected liberty or freedom that is expressed under the Due Process Clause of the United States Constitution. Tenants have the right to a quiet enjoyment of their home without trespass of the health hazard of secondhand smoke. When a rental agreement is ratified, the landlord has the implied duty of warrant of habitability for their tenant. As an attorney blogger Ann O'Connell wrote in 2020, a landlord provides a promise for a safe, livable place by simply offering the premises for rent. Tenants have prevailed in many lawsuits against landlords for secondhand smoke issues. A municipal ordinance is one implemented at a local level. It should include the smoking triangulum of tobacco, marijuana, and vape. The policy should apply to all housing with shared walls, so it would cover apartments, condos, townhouses, senior livings, etc. Citywide bans of smoking is not a new concept. As stated in the new report, the August 15th, 2020 report from American Non-Smokers' Rights Foundation, there are 63 municipalities, cities here in California that have implemented 100% smoke-free multi-unit housing policies across their city. Others are currently working on the topic. So today we've discussed an urgent public health issue. I've explained second and third hand smoke and why it's particularly deadly in multi-unit housing. I covered some alarming facts about the link between COVID and secondhand smoke. And finally, I touched on some efforts that communities are doing to fight back against big tobacco by implementing local policies. My hope is that I have convinced you all what a serious issue secondhand smoke is for those living in apartments. Big tobacco industry does not care about us as individuals. They are out to make money, not thinking of the devastating effects it can have on smokers and non-smokers alike. If you're stinking tired of living with or near smokers, get involved in a local coalition. Activate, join forces to change the social norm on the view of smoking, because it is not cool anymore to smoke, toke, or vape. Thank you, and have a happy holiday. And don't smoke.